Well, welcome. We're getting ready here in Boston now, hence the tie, but ready for TCT, and wanted to do a preview of some of the late-breaking clinical trials. I'm Chris Cannon, joined by my friend and colleague Deepak Bhatt, who will be there and covering all of these trials. I think headlined by some big ones on Tuesday that begin with the SAFE PCI study, one of these registry-based trials.
Yeah, it's an interesting, as you said, randomized clinical trial embedded in a registry that examines radial versus femoral access in women to see which one is safer. So an innovative concept using registries to examine important questions.
And then I think the first look at a big trial with the core valve, which I think will be terrific.
Right. The expectation is that it'll be positive just because the other valve that has been examined, SAPIEN, in a similar population looked good, but we'll see. You never know until you see the data, but the interventional community is very excited about that one.
And this is the so-called extreme risk TAVR trial, so I guess in people inoperative?
That's right, ones that aren't candidates for conventional surgery.
Well, that's terrific. Then I guess the following day, the EuroMax trial looks at ambulance-based bivalve versus 2B3A as sort of a new look in STEMI patients.
Exactly. So this will give us another assessment of bivalve root and whether it reduces bleeding risk compared to conventional therapy in the setting of STEMI and primary PCI. This one's got a European flavor to it, and there is some upstream therapy, as you said, starting in the ambulance. So some differences from the Horizons trial, which had also examined a similar question.
Well, it's great, and you know, with the constant change in the mix of what we do for ACS, we kind of need to update the trial and have another nice big one. Some other smaller, there's the CHILL-MI trial that will look at hypothermia, so another confirmatory or follow-up trial, I think, in that space.
Right, it'll be looking at infarct size, but it may give us some valuable insight into whether hypothermia is as good as many of us are assuming it will be.
Yeah. Then on Thursday, there are two trials on duration of antiplatelet therapy on the shortening side.
Yes.
So Optimize and Arctic Interruption. We have 3 versus 12 in Optimize and 1 versus 2 years.
So between those two trials, we should have, I hope, a refinement of exactly what the right duration of dual antiplatelet therapy should be in stented patients. So that should be very exciting.
And I suppose we'll have to look also, does it depend on the stent used?
Right, yes. I mean, that's the complexity when talking about dual antiplatelet therapy and duration. There's the presence or absence of a stent, there's the type of stent, and then there's also the underlying milieu. Was it an acute coronary syndrome or not? So a number of factors.
It's exciting. I see other, there's the Translate POPs is looking at platelet testing to try and, inform antiplatelet therapy choice. Another one of these registry-based studies. The GIANT trial that looks at P2 or CYP2C19 genetic profiling, and so that's always a...
Yeah, hopefully these trials will provide some clarity into whether platelet function testing and genotyping is actually clinically useful. No one's actually been able to prove that yet in these trials, but we'll see what these two new ones show.
Yeah, so it looks to be a terrific meeting at TCT. We'll have all of this and more covered during the meeting, and look forward, and please come back and check all of the new stories.